Hello everyone, I'm Dr. Roza Olyai, obstetrician and gynecologist. I thought I'll cover today something very important and which is on the rise, and that's obesity. Lot of patients, lot of youths, lot of young girls and boys are coming nowadays to have weights which are in excess of what they're supposed to be, with a high BMI. And this is on the rise. Well, obesity as such is when your intake of calories is more than what you're expending out, what you're exercising, and that is a concern, way of concern for us, because obesity leads into a lot of complications later on life. So it leads to a lot of diseases like metabolic syndrome, high blood pressure, cardiac problems, unable for girls especially not to be able to conceive. It leads to PCOD. I've got a video which talks about in detail about what PCOD is. One of the causes is obesity. It also affects other organs of your body, and overall one has to be aware of what you eat. Main thing is what you eat and how you burn it out. I would say that 80% should be of diet. We should have a proper proportion of eating proteins, carbohydrates, and fat. 20% I would say, yes, it's exercise. So it's basically what you put in your mouth and how you eat, what you eat. Do you eat in between your two meals, fibers, food? You need to have a lot of fiber included in your diet. I see a lot of young, boys and girls who are working in corporate, institutions, and their timing of sleep is also not correct. So you need to have at least 7 hours of sleep at night, because that again, if you lack of sleep, lack of rest to your mind, that also, the stress causes obesity, because you eat a lot. Then your timetable, your circadian timetable goes wrong. You need to be eating at a proper time. There is a lot of there are a lot of videos on how to eat, intermittent fasting, keto diet, a lot of things like that. I would say you should eat everything in proportion. It should be timely eating, and you should basically sunrise to sunset. When after sunset, you need to decrease your intake of food. No late eating, you should try to cut down gradually your calories at night. So good proportion of, spreading out your diet, which should consist of vitamins, proteins, carbs, fat, everything in a proper proportion. And of course, your portion that you eat, that is very important, the portion of food that you have. We sometimes sit together and eat a big, huge meal, but that's not really proper. And your stomach needs to rest at night. So you need to give your stomach a little rest and not to eat late at night. So take care of yourself. Do visit a dietitian if you cannot control your eating, especially those of you whose BMI is very high. So I would suggest that you need to consult a dietitian. And you can also do exercise side by side. Wish you all the best, and do consult a proper doctor for all your problems. Thank you.